Welcome to our virtual town hall. Thank you for being here. I'm your host, Bianca Banks. Before we get started, I would like to thank Providence for bringing all of these amazing voices together. And also, I would like to thank Dash Radio for giving us a platform. Let's meet our panelists. We have Dr. Karen Boudreau with Providence Health System.
Good morning.
Carrie D. English, model and actress.
Good morning.
Dayla Assari, medical receptionist and blogger.
Good morning.
Ina Mel, relationship coach.
Good morning.
Frank Alvarado, nonprofit board president.
Hey, good morning.
And Dr. Vanessa Casillas, with also with Providence Health System.
Good morning, everyone.
What we're experiencing right now with the pandemic is overwhelming, and there are real life impacts for many Americans, from job loss to trying to pay rent, putting food on the table, and simply meeting basic needs. We must acknowledge that the pandemic is amplifying disparities for many people based on race, gender, and more. All of this can have a devastating impact and a devastating and permanent impact on our mental health and overall wellness. So what happens now? How do we cope in this new environment? In this town hall, we'll discuss the challenges our panelists are facing right now and how it is impacting their own health. We will focus on what the future looks like, including how to access community resources and how to prevent contracting the virus, especially if you're not able to socially distance, so we can all be healthy in today's challenging and changing culture. So thank you all for being here. Dr. Boudreau, let's start with you. Can you talk to us about what's happening right now with the pandemic and how it's hitting some communities harder than others? Why do you think that these disparities exist? How has the pandemic amplified them, and what can we do about it?
Oh, that's a lot of great questions rolled up into one. I think one of the most difficult things that we're seeing with the impact of the pandemic is really the fact that it is really impacting different parts of our community differently. And when we first started off trying to understand the virus and what it was going to do, we started by thinking about, as we do in healthcare, we started thinking about it clinically. Which people are more likely to get it because they have this disease or that disease? It's hitting the elderly first and most significantly, which kind of makes sense, although other viruses sometimes have hit very young populations differently. So we started out by seeing this is hitting the elderly in particular. But pretty quickly, we started to realize that in addition to hitting the elderly very hard, it was very evident that we were seeing disproportionate impact of the virus on various communities, particularly communities of color, somewhat differently depending on where you are in the country, but universally we're seeing that our Latinx population, our Black population, our Native American populations, our Native Hawaiian and Pacific Islander populations, and our Asian populations are disproportionately impacted, meaning if there are, if there are 5% of any given population in the community and they account for 20% of the people getting ill, there's a disproportionate amount. You wouldn't expect one group of people to get more infections than others, and we're certainly seeing lots more infections in those communities. And my organization did a study sort of looking at that, and we expected to see the impact of health conditions and other things, which we saw some impact, but the main impact was really where you live, what kind of work you do, the circumstances in which you live, and certainly race and ethnicity were coming through, and speaking another language than English were coming through as showing disproportionate impact in those communities. And I think that reflects what we see across our country, is that we have disproportionate living circumstances. We have disproportionate jobs. So some people like me, I can come home to my guest room / office / gym / sewing room and work, as long as I need to, and I can be in this room by myself all day long. There are lots of people in our country who don't have a room where they can be all day long by themselves. And so we're seeing this impact really sweeping across the country, and it is waking us up again to some really, really significant disparities that we see.
I was having a conversation with a colleague last week, and I was, to your point, I was saying that, we are able to at least like quarantine in homes, and we have the luxury of having like Uber Eats or Postmates or, all of those services that kind of are at our fingertips. And I feel like, a lot of, people in our population that are in the underserved communities, it's like, they may be living with, have households or families that have like 10 or 12 people in them, it's just a couple of rooms, and they don't have the luxuries that, we have to just be able to be alone, by ourselves in a room, in a nice space. And so I do appreciate those things that we have. I can recognize that. So, even though we are facing unfortunate circumstances, it's not as bad as it could be. Carrie D, you have had an extremely challenging experience with COVID. Can you tell us more about how it's changed your life, how it's impacted your circumstances, and what's been the most difficult part for you?
Oh, well, thank you, Bianca. I just want to say I've had my experience with that has been hard. Extremely is, varied by person. Like we're saying, like how we started this, being very grateful for what we have and how I healed. I contracted COVID last month when I was going through an emergency dental procedure. Unfortunately, there's just things that you can't prevent when you're isolating, which is, a tooth being broke or whatever. And so having that, single woman, hey, isn't always as fun when you're going through COVID. I'll tell you that right now. Cats are absolutely useless when you're trying to heal. Anyway, so it was difficult because a job as a model and actress, my whole trade, thankfully, has been modeling and acting. But with the industry shut down, I'm like looking at, okay, what else can I do? I started modeling very young, so that's just been the only thing I've known. I haven't had a lot of job experience. No, not trying to make anyone feel bad, but I'm just like, oh my God, I gotta get some money in my account, because I think as Americans, I heard, and definitely for me, living as an artist, it's kind of like when you're up, and when you're down, and then it's not a lot of savings involved, which I'm gonna try to get really better at after going through this. But so after contracting it, after having job loss, and then going through it, my symptoms I have an autoimmune disease called psoriasis. So my system was having a hard time with it. Thank God I didn't have too bad of breathing problems. I got an oxygen monitor on Amazon to kind of keep an eye on it. Just really nauseous and stomach and bad headaches and the fatigue, and it lasted a good 3 weeks. I still have a little bit dull loss of taste and smell, which is annoying, but that's fine. But I think just the hardest thing was doing it alone, trying to stay off of too much news, because I think a lot of the news is really, really hard to watch when you're doing something alone. You kind of just got to bunker down and focus. And I had great, my family doesn't live in states. I'm in California, obviously, but I had a lot of people checking in on me, and that was good. That was a great experience. But it just, the mental health impact of it was hard, knowing that I live in a building where a lot of older people live. So I was collecting my trash on my balcony so I could take it out within 2 weeks, being really conscious of, my being able to spread it, even with a mask, just, it's a lot of things that go into it. So, I'm alive and well now, antibodies allegedly. So I'm kind of focused on that. But it was challenging, and it's definitely something that shifts you. I feel stronger that I came out on the other side, taking care of myself. And I had extreme empathy for anybody who's going through this alone, or the older people who have to separate from their spouse that they've been with for, decades. And I would cry on that and just being like, this is just impacting us all in different ways, whether you've contracted it or not. It is just mentally and physically exhausting. So that's to answer that.
Yeah, absolutely. To your point, at the beginning, well, first, we're glad to see that you're healthy and happy and on the other side of it.
Yeah.
Wow. But to your point, at the beginning of the pandemic, I had to adjust, and I had, my mother's 81 years old, so I have a son who's 9, so we had to move in with her and, make sure that her daily needs were met, because, it's like she doesn't, we do not want her to go outside, go to the grocery store, just all those things that we take for granted, really, just in our daily regimen.
Mm-hmm.
And so our lives changed as far as, then going from, having to be a mother who was, partly a teacher, partly had to, go into, I'm a pharmacist, so my background is, also on the front lines, but I'm not used to that anymore because I'm on the business end of things. But, I had to be there and redevelop a system for my staff. So it just really changed my life drastically in those arenas. So thank you for sharing that.
Yeah.
I'm really happy to know that you're okay. Frank, as someone who helps run a meal program, can you tell us what challenges you've seen as the pandemic has progressed, and how have services changed, and how has the clientele changed?
Yeah, absolutely. The program is Community Lunch on Capitol Hill, and we serve to anyone, but primarily our clientele are homeless and low income. And just like every other organization and business, you have to start making some changes due to COVID. And, for meetings, it's nice because Zoom is fairly common, and that's a tool that a lot of folks have been using. But the work that we actually do when we're executing our mission is with people. And so we're generally in a facility where we're interacting with people, we're serving them food, and, in our name is community, we want people to interact and talk with each other so that they can build that bond, because they may not have that based on their living situation. We've done some things. Well, first of all, we follow CDC guidelines. And so we've done some things like make sure we wear protective gloves, we have masks. We also make sure we have to monitor for the 6 feet away, because that's part of making sure that we're safe. But we had to just make some program changes as well. That included, so instead of meeting inside and having everyone inside a room, we actually moved the meal outside of the facility. So basically folks can come by and grab their food, and it's close to a park, so they can go to the park. But this ensures that they're not in close proximity to each other. We've also made it to go now, and that's more expensive for us because There's a cost for that. And then if you want to be eco-friendly, there's a cost for that as well. So we've taken on the additional costs associated with that. But it even goes beyond that because we have to provide education to our guests because they may not have the same access to things like the internet or TV. And so we have to be that resource for them. One thing that we've seen a change on is our volunteer base, and rightfully so. Some folks felt like they just couldn't be a volunteer anymore. We've got volunteers that are young and old, and we've been around for 30 plus years, and some of those volunteers have been there from day one. And we want to make sure they feel safe. So if they can't come volunteer as a primarily volunteer-run organization, we have to figure out how we can still do our mission. I will say though, for me, I think COVID has, in my opinion, impacted just the mental health part and making sure our staff feel supported, because it's really hard to be an essential person and doing this work and taking those extra steps to be precautious and still doing it with a smile and trying to make sure you're having a really great day or giving that conversation to that person in front of you. And so we've had to be thoughtful about how we support our staff, how we can make sure that we're flexible with time, making sure they feel very safe and secure while they're there. And it's working. We're still doing our mission, and that's great. Our audience has grown. I think we've seen some more folks come by just because, as I mentioned, we're open to everybody. So when things like job loss happen, you see more people come to get that food because it is free, it is made the day of, and it is something that it's a basic need. So those are just some things that we've done to modify our program while still doing our work.
I think that's wonderful. It's really interesting to see how businesses are modifying all of their services because they have to, with meeting so many different guidelines. But I think it's really interesting and really creative. And some of the changes I really enjoy, like a lot of the outdoor facilities and working out outside and your nails and it's good for the soul to actually do a lot of those things like in the sun and so yeah, that's great. Jayla, as a young career-oriented woman, I imagine that this has been a challenging time for you. You were supposed to start a new job the week that Los Angeles shut down, and you haven't been able to work since. Can you tell us about your situation and how it is impacting your quality of life and your mental health?
Yeah. Honestly, the timing of everything was just wild because I started my new job. I remember the date, March 17th. It was my second day of my new job. And, I was working as a medical receptionist for a plastic surgeon in Beverly Hills. And so I was excited. I was okay, I'm starting a job, starting a chapter. And at the end of the day, on my second day, my manager called to the office and was like, with everything that's going on, we're going to have to shut down. We don't know how long because surgical centers are considered elective and they had to close down. So my manager honestly like, we don't know how much longer this is going to last, but we'll be in contact with you, but we do have to temporarily let you go for now. And so she suggested to apply for treatment, go from there. But it's crazy because we had no idea it would last this long. We were thinking, maybe a couple weeks, maybe a month, and then I'd be right back in there. But I haven't been since March. So I think it's just the uncertainty of everything. It kind of can take a toll, especially for someone like me. I'm just someone who I like to be busy. I like to work. And if I'm not doing something all the time, I kind of feel like I'm not being productive. So that's kind of taken its toll. It's definitely been a roller coaster, mentally and emotionally. There's some days where I'm feeling good, I'm feeling productive. And then there's some days where I'm not feeling so good. I'm feeling, sad or a little discouraged. But I feel like I'm learning to kind of go with the flow and just take things one day at a time. These are unprecedented times, and we kind of just have to take each day as it comes. So I feel like that's what I've been doing. But I also feel like with that and with the extra time that I've had, I've really been focusing on my mental health and self-care a lot more, whether it's doing yoga more or working out on a more regular basis, watching what I eat, reading more books, things like that. So even though it has taken a little bit of a toll on my mental health, it's also made me focus on it more and do things that can help me and just have more awareness of my mental health and just my emotions during this time.
Yeah, I think we've all been there
Yeah.
in this pandemic. And that was one of the concerns, with my mom, because, it's not really a great idea for someone to be like, my mom hasn't left the house since March. I know that date specifically, you were saying the 17th. For us, I think it was like the 12th when like our school district started to close. So she's been in the house since then. And I think that, I was like, Mom, like every Friday we should just go drive around. You don't have to get out the car. But I think like I think it's really healthy to have, at least like a mental exercises, you know what I mean? Visually stimulating things that, that can help you. So that's, I totally understand where you are. Yeah. Dr. Casillas, how is our current environment impacted mental health services? Are you seeing more people reach out?
That's a great question. There's so many things I think about the environment right now that are just like ripe for impacting our mental health. You think of social distancing and the isolation that that's created, like your mom not having, been able to get out of the house probably like usual, or Jayla not being able to start the job that she was so excited about. I think too, things like school closures, our family members, even ourselves losing jobs, questions about finances. Jayla mentioned too, the level of uncertainty that exists right now. I think all of these things are things that impact our mental health. What we've seen happen across the board is in all of our outpatient programs, there has been an increase in both the volume of patients seeking care, but also the acuity as well. I think part of that is just a pandemic layered on top of existing mental health issues that folks might have been struggling with. I think too, for lots of us, we're experiencing issues with mental health that maybe weren't present in our lives before, so we're feeling more stressed, anxious, and depressed than maybe we had been in the past. I think the one silver lining of COVID has been the push towards telehealth and access to telehealth for people. This is something that was being done sort of in pockets of places before COVID and this pandemic, but I think it's sort of rolled out in this really large scale. And I hope that's something that a service or a type of service, or how we provide a service, that we can continue with in the future, because I think it's made mental health services more accessible to people than ever before. People can access this support from the comfort of their own homes. So I think in that way too, that's probably driving some of what we're seeing in regard to volumes. But there's so many impacts to our mental health in regard to what's going on right now.
Yeah, I agree. I can appreciate the virtual services, and I do agree with you. Like before, it was like kind of a little sporadic. I don't think it relied on it as much as obviously they are right now. And for us, it's been a great help because we have, like, for example, we have a program with a hospital, and so we have to discharge the patient, but from the bedside. So how do you do that? Well, we just FaceTime over, for patient consultation. So it makes it easier. And I think, a lot of people enjoy it because sometimes it's like going somewhere, it requires a lot of effort, right?
Absolutely.
Like you have to plan, and you have to, maybe it's stop for gas, this. So I think it has, to your point, a silver lining, even though it lacks socialization, I guess personal, to some level, but yeah, but it is a silver lining. So I definitely agree.
I also, can I just add a question? I also wonder if it doesn't help to normalize seeking help, because it's such a, we're so used to talking to each other now this way through the computer or
Right.
through the phone, and taking away that need to get in the car and go someplace and sit in a waiting room and what are people think, whatever it is, whatever the things that keep people from going to get care. I wondered whether the telehealth, particularly with behavioral health services, doesn't help to kind of reduce some of those barriers.
Right.
Absolutely. I think it helps reduce sort of a layer of stigma that does exist about, like, I don't want to be the person who goes to that office or sees those, that kind of professional, or could be seen in a waiting room. If that is something that was holding people back from connecting or engaging in mental health services before, my hope is that that's eliminated now by being able to access them from your home.
I agree, because there is a large population of people that are afraid to go to the doctor even, right?
Yeah.
And so I know, like, for my mom, she's had like 2 or 3 telehealth or telemed appointments, and she, it's not bad, because before, you would think about you know her getting up, going to, getting there, then transportation, then waiting in the waiting room, and all those things, and now it's like really accessible.
Yes.
And so I think that I would hope that it would encourage more of us that have those fears of, going to the doctor. I would hope that it would encourage people to really, have more, a willingness to want to have access to your, for your healthcare. I know for, like Carrie D was saying, some circumstances are kind of an impossibility, like when she had to go to the dentist. So that actually was my fear, because I've been wanting to go, but now that she shared that, I'm like, okay, I'm not going to go. But yeah.
Do it. No, I'm kidding. Do it. Take care of your oral health. But oh my gosh, try your best to floss and rinse with salt at night. Until this is getting better.
So, but how do you know that you contracted COVID from the dental office?
Well, there could be a slight chance that it happened when I was, driving home, but I'm just looking at my hypothesis of sitting in a chair for 9 hours, because it was pretty extensive what they had to do. It was like 8 hours pretty much with my mouth open and being, like, you can see my psoriasis, like, so I'm getting pretty beaten up just with my immune system. So when my immune system is compromised, I'm in such a state of stress, my mouth is like, and all the pain, that just really put my immune system, like, it shut it down, and I was under a lot of stress, and that's kind of usually a recipe for me to get sick. Stress. I don't like dental work, which is probably the reason why I had the emergency, because I tend to put it off, and it's very expensive, but don't put it off. Trust me, it's not worth it. So I've just figured I got it from there, because that's what I was doing for all that time. And before, I was being very careful and I wasn't going out. I supported Black Lives Matter movement by donating to places from inside the house. I didn't do protests, so I knew I wasn't getting infected from that. It was just the only social place I went. Even my groceries, I was having somebody bring them by. I would go on walks, but I wasn't walking with anybody. So it's just, that's my guess. And I knew I had it when you just know. For me, I just knew it, because you just feel like a train hit you, for me, and a bus, and then like a cat, and then all your ex-boyfriends and their girlfriends are just hitting you up. That's how I felt. I just felt really beat up, and then when I tried to eat something, I couldn't taste it. I was like, I was like, no, the Rona, and it just got progressively worse, and then it started getting better.
Thank you for sharing.
Yeah.
Ina, you coach people in relationships. Can you talk to us much about the financial burden and the stress that plays in our relationships? How are you advising your clients to cope with today's challenges? And what tips and resources do you recommend for healthy relationships?
Yeah, that's a really great question. I strongly believe that financial stress can really bring out the worst in couples. It causes, increased conflict. It really just reduces the quality of the relationship as a whole. Therefore, I do believe that, it's very important to just kind of remember that you and your partner, you guys are a team, and therefore you have to, respect each other, be there for each other, show love, show affection, validate your partner's feelings. And I think all those things will really help you in time, of stress or times like this. As with something like a financial hit, like a pandemic, I think that it really caused a lot of people to have all this, extra stress. And so communication really is key. What I like to do is create rituals of connection where you check in with each other, maybe 10, 20 minutes a day, where you discuss, your worries, you discuss your concerns, you talk about how you can support one another through this time and how each partner can really meet each other's needs. I think those things really are very helpful during this time. Also, I would suggest creating a monthly budget, basically where you agree, to cut all the unnecessary expenses, as well as, I know this may sound a little weird, but, give each other allowances where you set a certain amount of money that each person can spend without having to go to your partner, and asking them like, can I spend, $50 this week or whatever? And I think that will alleviate all that unnecessary stress. And it also kind of gives the couple a feeling of control, where it's something that, they're able to control and communicate all the expenses and stuff like that. Another thing I would suggest is if both partners are working from home, as a lot of people are, for instance, I work from home and my partner was home for quite some time. I think it's important to separate workspace from private space. That way you don't feel like you're cluttered together, all day long. And then when the time comes, you get to spend all that time together, but then you also have that time apart that you're able to spend. And just a reminder, just reminding my clients that, date nights are crucial. If you can do once a week date night, I think that it doesn't have to be anything fancy. It could just be, cooking dinner or watching a movie, or even something as simple as going for a walk, or just sitting on a porch, drinking coffee or tea and just communicating. I think that would really help out during this time. And just to kind of, remember and remind each other that this is a very vital time. However, we have to come together as a team, support each other. Remember, this pandemic is not permanent. However, the value of the relationship is, and so you have to stick to each other and really stick by each other. I think those things are just very important to kind of constantly remind yourself and remember.
I think those are some fantastic helping tools because I've unfortunately, you see the some reporting where they're saying that divorce is at an all-time high, or
Oof.
relationships, ending during this time. And
Yeah.
I also think that, to your point, it's been nice for me, like, as you are outside, as we mostly are, and walking, and I really enjoy seeing families fellowshipping together and having socialization, whereas before, you really didn't see that. You didn't really see whole families,
Mhm.
or like
Yeah.
even my neighbors. I'm like, oh, they live here, like, really, like, it's been nice to see, um how again, people have had to become creative during these trying times, and so not all of it has to be terrible. I think that
Right.
one thing, that I would like to have, or I would like to see moving out of the pandemic, is still having that connection with things that really matter, our family, and
Mhm.
so I think that that's been, really, um, near and dear to my heart during this time to see. So thank you for sharing that.
Yeah, absolutely.
Dr. Boudreau, the reality is that people need to work, and this could put them at this meaning the pandemic can put them at risk, obviously, for contracting the virus. Is there anything, as healthcare providers, we can do to avoid getting the virus when we can't obviously social distance? What recommendations do you suggest?
Well, I think, the advice is actually very straightforward, but it's amazing to me that even this far into it, we're still learning what is effective, and B, we're still finding that a lot of people really don't have good information about what they can do. And I think part of that is related to the fact that we keep changing the rules about, you need to be this far, you don't need a mask, you do need a mask. That, I think that's very confusing to people, and it makes it more likely that they're not going to believe what we say, and so that's very frustrating. I will freely admit that I was relatively late to the everyone should be masking in public school, just because as we were looking at the data and they were saying it's really not airborne, it's really not droplet, we don't think it's being spread by people who don't have symptoms, um, and I think in the end that was unfortunate, that we should have used our common sense and said, if we're not sure, let's start from the beginning by giving people practical advice. And so masking when you're outside, when you're out of the house, um, if you are living in tight quarters, um, considering masking at home, even that's hard for people to think about, but whatever we can do to sort of keep, I always say, keep our spit to ourselves, keep our droplets and our breath to ourselves, is really helpful, especially if you're living in close quarters, making sure you have ventilation. I'm a little worried about what's going to happen in cold climates when it gets to be winter. And I can imagine it's also very difficult in very hot climates where you can't just open the window because it's 110 degrees outside or whatever. So I think ventilation, masking, hand washing, simple hand washing, keeping your hands clean, soap and water works great multiple times a day. Reminding ourselves, I think we were all very good at 20 seconds of hand washing at the beginning. Maybe that's falling off a little. That's a good thing to remind ourselves, twice through happy birthday or whatever you like for your duration of 20 seconds. And then, if you are going out into the workplace, making sure that you come home and change your clothes, put them right in the wash, anything that's going to potentially be bringing, uh, things that may have been contaminated by droplets that might bring the virus into your home. I think the hardest thing really is for people that live in multi-generational families or in households where they don't have the space to separate. And I think just whatever you can do to give yourself space, time your walk so that some people get a little time by themselves at home when other people go outside, and thinking about those kinds of things are really, really important.
I agree. I agree. Frank, how do you feel about that? Because you're also working with the public.
Yeah, it's hard, and you think about all these things all day long. And at the same time, you have to be precautious, and I really appreciate that. Like, for me, though, I feel like for me in my household, me and my partner, for us to stay safe is important, but we also want that social connection. And so we live in a condominium, and we have another couple that lives in our building that we're fairly good friends with. And we sort of talked about this early on COVID, and, we set some parameters because we felt like these are folks that we can do stuff with from time to time, go hiking or something. But we also share enough information that, hey, this is the way, like, while COVID's going on, we need to make sure that we're not interacting with other people. Like, we're going to choose to interact with each other, but that's a safety risk by itself. But this will help keep us somewhat mentally sane, and at the same time give us that ability to, like, hang out and maybe watch TV. We're not going to be all on the couch, but we're going to be spaced apart, but still having that, because personally, I don't really like the term social distancing. I think it's more about physical distancing and social connection. And I think that is really important to stay safe, not just these boundaries you put in place, but just the mental part about it as well.
Yeah, I think that's great. I have also, to your point, I have a family that I kind of connected with right at the beginning of the pandemic, and so it made it a little easier for my son and their son to continue, like some schoolwork together, or we go on hikes together, things like that. I totally understand that. Does anyone else want to share what they've been doing about as far as preventative measures during the pandemic? No.
I can go ahead and just kind of go off of what Frank was saying. I feel like I've been doing a similar thing. I live with my grandmother currently, and she's 82 years old. So I have to be very, very careful about who I'm seeing and, taking all of the preventative measures. So same thing, very similar to Frank. At the beginning of the pandemic, whoever I was kind of comfortable seeing and would be comfortable seeing throughout the duration, that's who I've been hanging out with. It's a really, really small handful of people. I'll see my boyfriend, I'll see a couple of really close friends, but there are people that I trust and there are people that I know. They're isolating, they're not really going out, because I do have some friends who are out and about and they're kind of partying and, being a little bit too social for my liking. So I've decided to distance myself from them. We can FaceTime or hop on a Zoom call or whatever, but I'm just choosing not to hang out with them in person just yet. But for those handful of people that I am comfortable with seeing, that's who I'll hang out with. And something that I've really been enjoying, especially in the summer, is we'll go like on a little picnic. We'll find a really big park where, you can physically distance from other people. So that's just a nice way to get out, socialize, get some fresh air, and still do something that's fun.
Mm-hmm. Awesome. Dr. Casillas, not only are we facing constant isolation in the pandemic, but there's also the added stress of racial injustice happening in our country, as you know. So how do we maintain our mental health or break the cycle of despair that we're living in? When is it time to get help from a professional?
Yeah, that's a good question. I think right now, given everything going on between the pandemic and also the issues of racism that are unfortunately alive and well within our world in so many different ways, it's really about being realistic and focusing on self-care and focusing on those things that are within our circle of control or influence. I think right now it's so easy to get focused in on sort of all the things out of control all the things that are uncertain about the time we're living in. But in saying that, I also want to normalize those feelings as well, because I think more than anything, like, this is an extraordinary time for so many reasons. This is obviously something that for a lot of us, this is the first time we've been living through a healthcare crisis like this. It is, a time in our history where we are finally standing up and speaking out against the issues of racism and really demanding to see change. And so feelings of overwhelm, feelings of stress, feelings of heightened anxiety, maybe feeling even depressed, each of those things I think really is sort of to be expected given everything going on, and are really normal given the current circumstances in a situation like this. This pandemic in and of itself has been really traumatic for a lot of us in a lot of different ways. And so I think giving ourselves some grace, extending ourselves some self-compassion with how we sort of internalize that and make sense of it is really important. I think these things take an adjustment. So feeling these ways for a period of months, until we start to see some resolution, I think is to be expected, and people can sort of, bet on continuing to feel these ways. I think things that would be indications as far as, should I reach out for help? I think first and foremost, if you feel like that's something that would be beneficial to you, regardless of the severity of how you're feeling, I would encourage you to do so. Like Frank mentioned, social connection right now, being connected to others, having conversations about how you're feeling can be so helpful to getting your thoughts and feelings outside of yourself. We can stew on them quite a bit. I think too, though, if you notice really significant sort of changes in your daily functioning, difficulty getting out of bed, not wanting to talk to anyone, friends, loved ones, noticing changes in your eating, your sleeping patterns, significant changes like that, I definitely wouldn't wait until you feel like talking to someone to talk to someone at that point. I would reach out and do it as soon as possible. I think when things get to that point, if we wait to do it until we feel like doing it, we can wait a really long time. So encouraging folks to do that. I think too, looking out for one another. If you notice change in other people around you, ask them how they are. Attempt to connect with them in a meaningful way. Even though we're doing that differently right now, it can go such a long way for people. And I think, again, normalizing all the things about this time and feelings of anxiety, depression, brokenheartedness about the issue of racism and what we can do about it.
I also worry about people with substance use. There's a lot of joking about, and there's information out there about increased use of alcohol and other things, which, for some people may be perfectly fine. For others, it may be a sign that things are really turning south for them, and, turning in a way that could be dangerous for them. So I think watching out for changes in substance use and is another big one that we ought to be careful about. Or ice cream in my case, but
I agree so much with the substance abuse. It's really hard because traditional AA meetings aren't open. I know a lot of people struggle to stay sober. Plus, like, social media is normalizing drinking as a way of coping. That it can be really dangerous. It's like, well, they're doing it, I'll jump too. So I like that you guys said that. I agree.
Right. It's been interesting to see how much like alcohol to go has been sensationalized.
Oh yes. Absolutely everything. Just drink it off. And it's that, I mean, yeah. It concerns me, and I've seen it within myself too. My consumption go up and down, and just being like, this is making it harder. It's like pouring gasoline on depression, and I have depression. So it's just like, it's not help. I mean, it might alleviate really quick, and then the tenfold repercussions, it's just not worth it.
Mhm.
So I'm just glad we touched on that, because I know that's been hard for people, and just the normalizing of it is just disgusting, in my opinion. Just like,
Yeah.
oh, just drink it off. Just get really drink and be in close quarters with somebody. No, it's the
Mhm.
worst idea for your mental health and for anybody around you.
Right. So actually, Carrie, let me ask you, Carrie D.
Mhm.
So about your mental health, I know you've always been open and honest about it, and thank you for sharing just now. But how are you taking care of your mental health during this difficult time? Like, what
Uh,
tools can you offer?
Well, you're so sweet to ask this. I am a very big advocate of mental health. Having depression, having mood swings, and having a lot of things and a lot of trauma in my past. It's difficult for a lot of people with mental health to talk about it, but I love the place that we're in, that we're speaking about it more, and we're taking away the stigma. And for me, as we were saying before, that watch out for those signs of depression worsening. I've definitely, I don't want to say the word relapse, because relapse almost has a negative indication or connotation, but I worsened after my experience with COVID, for just being immobile for those 3 weeks and just watching so much TV and like just things that aren't normal for me. I'm an active, bubbly person. So when I got out of that, I was weeping constantly. I felt like my heart was breaking, not just because I was feeling bad for myself. I was just wildly depressed. So I decided to talk to my psychiatrist and get back on pharmaceutical therapy. And I haven't been on one for 5 years. And I saw myself kind of being hypocritical, because I was like, yes, if that's what works for you, absolutely, take the medical approach. But then being like, I'm not on anything anymore. I do everything naturally, and I'm drinking celery juice, and you know, sometimes it just doesn't work, especially when there's just like so many outside circumstances coming in. So I got back on antidepressants. It's been about a month now, and I'm starting to feel them take hold, and that worked for me. I'm just saying, if it does get too heavy, and it got too heavy, and I had to really sit down with myself and be like, how am I self-medicating? Drinking too much, or just isolating, not talking to people. Getting out of bed was like, I'm like, I don't deserve, anybody with mental health doesn't deserve to have that much of a struggle. And I was like, antidepressants won't help. I got off of them, and then but I'm not advocating for either, whatever you choose. But if you are in that spot and you're not getting out, like, just be honest with yourself and be so gentle and patient, and reach out, because I feel better. I feel more manageable. I just feel like my volume is turned down on everything that's happening. And it was real. It got really, really dark, and I'm just gonna get real about that. I feel better now. So it's hard to go back into that. Like, it was so dark, because I feel better now. My mood's better. But I had to remember that is capable of happening to me, and it's absolutely capable to happen to anybody, especially with what we're living through. So no shame in getting, health, all health as well. If you're social distancing or, being safe, also mental health is just as important to take care of. So lower that drinking, lower that like screen time, read, meditate, get on a podcast that talks about mental health, just so you don't feel alone. That's my advice. I talk a lot.
No, thank you for sharing. Absolutely. So I've always been a strong believer in conflict resolution or solutions. And so I want to talk a little bit about what can we do moving forward to be healthy, especially because we're facing such a challenging and changing way of life. Frank, as someone who leads nonprofit services, where can people turn to find trusted resources in their own communities?
The great thing right now is you can find those resources depending on where you live, sometimes in the city, sometimes in the county, or sometimes in the state. For folks that have access to a computer, you can just use a search engine and use key phrases like food resources or basic need resources. I did that earlier this week. And a list comes up of lots of different things that you can just start investigating. Sometimes though, folks don't have that access to that computer, so you can find a public space like a library. That's great. But the other thing is, if you do find an organization that supplies one of those resources that you find really helpful to your family, oftentimes you'll find that that organization also knows other organizations that can help you. They don't do exactly what you do, what they do, but they say, oh, here's another organization. They can help you with, problem B, and they can help you with this. And so, like, for example, community lunch, we actually have a pocket-sized document that our guests can take, and it lists other organizations that provide essential services. It includes an address and a phone number, so they can have that with them as they go. Depending on your neighborhood, you might have a community center, so you can check that out, and those places are there to support the folks in the area. I think those are really great places to start, and the conversation, as you find those, you'll find more and more branching off from that.
I agree. Absolutely. Dr. Casillas, can you share some ways people can begin to plan for such an unpredictable future?
Yeah, I would say be kind to yourself, be kind to other people. Spend some time focusing on, like I was saying, sort of what's in your circle of control or your circle of influence. You find yourself kind of focusing on sort of all the things that aren't going well or aren't going right. Practice redirecting your attention if that's something that you find yourself having a harder time doing. Even be more intentional about it and set aside some time to really sit down with a pen and paper and sort of map out, these are the things I'm going to do for myself today. These are the things I'm going to do for others today. And, engage in positive self-talk. Reach out for social support. Frank's mentioned it a couple times. Just because we may be sort of further apart, sort of physically right now, we can absolutely stay connected socially. And it's so funny to think that we're doing these things for the first time. I'm like, why didn't I FaceTime all my girlfriends this much before? Why didn't I FaceTime my parents before? And be really intentional about that. I think too, when you notice feelings of uncertainty show up, normalize it. It is okay. It is to be expected. It is really just kind of a sign of the times we're living in. But be careful not to sort of cling to those thoughts, and we tend to wrestle with them. We want them to go away. And then we become fused with them in a way where we're sort of everything in our lives we're looking at from that perspective rather than seeing those things as being outside of ourselves. So this idea of looking sort of at our thoughts rather than from our thoughts can be helpful in sort of gaining some perspective. On self-care, whatever self-care looks like for you, that looks a lot of different ways for different people. But rely on the things that have worked for you in the past, and especially those things that you sort of live in alignment with what you value and the person that you want to be. Drinking's come up on this, and it's obviously something that there is a lot of light being made of alcohol consumption right now. But if alcohol consumption isn't something that moves you towards your values, your goals, the kind of person you want to be, that's probably something to steer away from. But if exercise is, if staying connected socially is, if holding to a routine is, do all those things. But again, I started with this and I'll say it again, be kind to yourself and we really need to take care of one another right now and come together in a time where we're farther apart than ever before.
Absolutely. How does everyone else feel about what Dr. Casillas mentioned?
I love the notion of being gentle with yourself. I'm going to sneeze. Excuse me. Being gentle with yourselves and gentle with people around you and looking out for those signs. And I think also asking for help or looking for help when you need it. I think there was a lot of energy at the very beginning of the pandemic of, making sure people had food or cleaning supplies. And as this has waned on, that becomes harder and harder, and people may not remember that there are services out there. We put together a list of services, social services, mental health services, and other services in each of the states where Providence has a footprint. So Alaska, Washington, Montana, Oregon, California, Texas, and New Mexico. And there'll be a website that you'll be able to see that has those resources available to anyone. And just really not being afraid to ask for help, I think is really important at this time.
Absolutely. And I would like to invite everyone to share and to, add takeaway comments for this conversation.
I'll share something. I mean, I agree with all that. I think it's really wonderful. I'm a very routine person, and every morning I start my morning. I'm the first to wake up in my house, and every morning I've just got these things I do. But one of the first things I do is I actually have 3 daily prompts every morning, and it's I will let go of, I'm grateful for, and I will focus on. And for me, I don't write it down. I used to write it down anymore, and it's just a good way for me to remember what I need to let go of, what I should be appreciating, and what am I going to take care of today? Because I can't accomplish everything, but I can. If I just pick one thing, I can get that done.
I think that's wonderful. Yeah, I've been practicing no social media for 3 hours, the first 3 hours. And then just kind of find like my center for the day, and like my meditative space. So I can understand that. Would anyone else like to share their takeaway for this conversation?
If I can also add, I've also been trying to minimize my just technology intake, especially in the morning. I feel like how you start your day will determine how you lead your day. So it's important to be mindful and just being grateful. I think gratitude at this point comes in handy. Just being grateful for, having a roof over your head, for being healthy, for not having anyone die or be sick in my family. So just practicing gratitude and gratitude towards myself and my partner, as well as friends, family, the community. So that's been super helpful for me.
Absolutely. Jayla?
I was just going to chime in because just like what she was saying, what I've been doing before I go to bed, I'll just kind of run down the list of things that I'm grateful for, just because I think it's nice right before you go to sleep. It puts you in that grateful headspace, and I think it helps me sleep as well. And something that I started doing recently, wake up, now I'll start to say, I'm excited for today. Even if I have nothing planned, or if I'm just like watching Netflix all day or whatever, I still say I'm excited for today, just so that I'm open for whatever the day is going to bring me, and I'm ready to kind of take the day slow. So yeah, I think gratitude is really, really important, and just kind of celebrating even the small accomplishments or the small things that you got done for the day, and then just acknowledging the fact that you're alive, you're healthy, you have access to certain things that a lot of people don't. Technology, so just kind of putting things into perspective and remembering that.
Absolutely. Carrie D?
I would say whenever things were getting, dark and hard and trying to climb out, I would get on my phone and ask somebody else how they were doing, with the intent to listen, not for the intent to unload how I was doing. That really helped, because I was like, oh my God, because sometimes when it's so depressing, you just think you're just in it alone, and it's important to reach out just to simply ask how somebody else is doing and really listen. Keep asking questions so your crap goes, and then you get to really focus on somebody else. That's helped me. And then I guess, if I feel anxious, that probably means I'm thinking of something in the future that I can't control. If I'm feeling depressed, then it's probably something in the past. And so I just try to really be as mindful as possible if I'm having a good mood day, without the mental health issues taking too much control. just being in the moment and be like, this is the only moment. And as everybody said, the attitude of gratitude is everything, because it's all kind of been like, we lose a little bit at a time. We've lost, and then we kind of gain things, so we get happy again. And just noticing like what we have, what I have as an individual, like our own space to have my own meeting in my own room. As we started getting into this conversation, it's just little things become big, and just keeping that in mind, it kind of gets you out of that sinking sand of, you know, a downward spiral. So attitude of gratitude, that's all I got to say.
Absolutely. So one last thing we did not discuss today, but it's extremely important, are teachers and others who are mandatory reporters of abuse and out of the picture due to isolation that COVID has created. Please visit the website linked in our comments to learn the signs to watch for and where to go for help. Anyone affected by abuse can call the National Domestic Violence Hotline at 1-800-799-7233. Thank you, everyone, for joining and for participating.
It's a great conversation.
Absolutely.
Great
Yeah,
to
thank
have
you.
that conversation with everyone. I'm proud of everyone's advice too. I took a lot of it, so thank you.
We're glad you're better.
Yes. My goodness. Thank you
Thank
so
you
much
for having me.